Hello everyone, I'm Dr. Emmanuel. Um, I'm going to be talking about some medical conditions. This is the very first video I'll be producing as regards to discussion of medical conditions. And my sole purpose of producing this video, both this and the subsequent ones, is for the general public. I want to try as much as possible to use general terms when describing medical conditions, even though it's not easy, but I'll try as much as possible because I wish that the general public, not just the medical folks, the layman will understand what I'm saying. Okay, so we are going to get started. Um, want to be I want to start with um, a gynecologic obstetric condition. I'll, from there I can move to gynae, can move to medicine, can move to general topics. It depends on we flow as time goes on. Try as much as possible to find out time to always produce such videos that will benefit people. So now I want to talk about what gave birth to obstetrics, which is pregnancy. It is somebody that was pregnant that gave birth to a woman before they start having gynecological issues. So that is why I'll start with obstetrics. Now, pregnancy. Pregnancy is simply when the sperm from the man fertilizes the egg from the woman in the fallopian tube, and then they form zygote which implants in the uterus known as the womb of the woman, and then the child begins to grow from there and up till 9 months when the woman usually delivers the child. Now, but I won't go into details so that you can actually follow and understand what I'm trying to say. Now, pregnancy. When is a woman said to be pregnant? Pregnancy, the first very symptom of pregnancy is amenorrhea. Amenorrhea means that there is cessation of menses. The normal menses that people see, that women see every month, you will not see it for a particular period. They will begin to ask that, why am I not seeing my period? So, for women that have regular menstrual flow, they will be able to notice that they missed their period. But for women who do not have regular menstruation, it may be difficult to notice that they've actually missed their period. So, but what the other symptoms that you will see apart from skipped menses is the fact that there will be breast tenderness. Then there will be early morning sickness. Usually, that is what we call the nausea and vomiting that comes with pregnancy, and this is as a result of the production of a particular hormone known as human chorionic gonadotropin, that is a HCG. And when you do your urine pregnancy test that I usually do at home, this is the hormone that usually makes it to appear positive. And you usually come to hospital and say, doctor, I did urine PTO pregnancy test, that is PT, and it showed 2 lines, meaning that it's positive. So those are the signs that you feel. So when you come to the hospital, what I usually do is that I try to repeat with serum. I usually prefer to use serum. Serum, your blood will be taken, and then the plasma, that's the one that settles on it, the blood will settle down, then the fluid on it is the serum will be used to do the test. And if ultrasound is readily available, we can also use the ultrasound to confirm the pregnancy depending on the week at the last the time you missed you saw your period last, because some ultrasound can detect as early as 4 weeks. Some other methods, probes, can use to determine pregnancy later. Now, but the very 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 accurate way of knowing whether the gestational age of the child, of the baby, of the growing baby, is to calculate from your last menstrual period. If you are very sure that this is the last time that you saw your period, that is the first day of the last menstrual period, because you normally see it 3, some people see it 3 days, 4 days, 5 days, 6 days, like that. So that very first day of that last normal menstrual period, we will use it to calculate and we'll get the accuracy. So to back to diagnosing pregnancy. So we do the serum PT. If it comes out positive, or we can do the ultrasound. It can also come out positive. Then we'll book you and begin to prepare you for the baby that is yet unborn. Begin to take a lot of multivitamins, folic acid, ferrous, for the well-being of the baby. And then you also give your appointment that you come to visit us from time to time. You do a lot of ancillary tests, routine tests, to be sure that you don't have any underground medical condition that may compromise the baby and even your own health. So this is it about pregnancy. So usually we divide pregnancy into 3. There is first trimester, that is the first 13 weeks. Second trimester at the first that 13 weeks, making 26 weeks. Then the third trimester, that is from 26 weeks till 39 weeks when you give birth. So this is just the short thing. So when you have such symptoms, you come to hospital, be tested, and then booking early is very, very important. Booking early is very, very important, and initiating folic acid supplements in your medications and your meal is very, very important too for the baby, because sometimes when you don't take folic acid, it can lead to congenital abnormalities in the babies, and that is why you keep to your appointment. There are periods of time you will have to do some ultrasound, at least in a full time that you will be coming for visits. You will do at least 3 ultrasound scans. There are sometimes you'll be giving some injection, like tetanus toxoid injection, to prevent certain occurrences later. So this is the bit I will say today, and we'll continue next time. Thank you very much. I hope you enjoyed the video.